All right, to finally wrap up the axial skeleton, we can talk about the thoracic cavity or the thoracic cage. But the thoracic cage makes up the thoracic cavity, as we've talked about, which is housing the lungs, the heart, vital organs, protecting them. Okay. So, in the thoracic cavity or cage, we have the sternum, which is, we can feel that on our own body. If we were to, I think we refer to it as our breastplate. It is medial and anterior in our thoracic region. If we were to press on it and talk, we would make this noise, right? Yeah. That's the sternum. Now, connecting to the sternum, and the thoracic vertebrae, we have ribs. Now we have 24 ribs total, 12 pairs. Okay, so be careful of the wording. 12 pairs, 24 total, 12 on each side. Okay, I want to talk about ribs first. So let's talk about these ribs. Now, ribs are directly connecting and articulating with the thoracic vertebrae in the posterior direction. Anteriorly, ribs do not articulate to the sternum. All right, they have cartilage that articulates to the sternum. So the bone of the rib does not touch the bone of the sternum. So we have this costal cartilage. So this is hyaline cartilage. Costal, we got to remember, just got a word association. Costal is going to be with the thoracic cavity. Okay. So the goodness. Okay, so with the ribs, we have different classifications. We have true, false, and floating. Now, sometimes people put floating as a sub-classification of false. It's not wrong, it's perfectly fine. Okay, so let's talk about what these actually mean. So to be a true rib, generally, in an average American, this is ribs 1 through 7. Not just an average American, average human. So sorry. Average human, it's generally 1 through 7. Okay. So let's think about look at the difference between ribs 1 through 7 versus the other ones. Here we have the sternum, costal cartilage, rib, sternum, costal cartilage, rib. Continues. 6, we have this costal cartilage, comes down. 7, we have this costal cartilage, comes down. But then 8, rib 8 is kind of like, where's that costal cartilage? It piggybacks onto 7. So to be considered a true rib, ribs 1 through 7, you're going to have a direct connection to the sternum via costal cartilage. All right, it is direct connection to the sternum via costal cartilage. To be false, you have an indirect connection to the sternum via costal cartilage. All right, so 8, 9, and 10 are considered false in the average adult human. Okay, these cartilage, they have costal cartilage, but they all piggyback on each other, connect to 7, and then connects to the sternum. So it's an indirect connection. All right. The portion of costal cartilage that is, piggybacking 10, 9, and 8, this whole portion of cartilage that piggybacks onto 7, that is called the costal margin. Just fun fact. Okay. And then to be considered floating is that you have no connection to the sternum at all. Okay. So there's no costal cartilage that's coming off of these ribs back here, 11 and 12. They literally are floating. They are not connected to the sternum at all. So true, 1 through 7, true ribs have direct connection to the sternum via costal cartilage. False ribs have an indirect connection to the sternum via costal cartilage. And floating ribs, a subclassification of false, they are not connected to the sternum at all. All right, so those are your ribs. And I do want to just kind of point out over here on this side, if we're looking at the rib, you don't need to know these markings, but you can see how here is a thoracic vertebra, right? And the ribs are going to articulate with it. So we can see there's this articular facet that's going to articulate with a transverse costal facet, that anterior facet off of the transverse process on the thoracic vertebrae. And then the head of the rib is going to articulate at the superior costal facet and the inferior costal facet of the thoracic vertebrae. So those costal facets I was going on about, you can see how they actually articulate to the rib to allow that posterior connection, and then the rib wraps around anteriorly. Then it has costal cartilage, and then it'll connect to the sternum if it is true or false. If it's floating, it'll just kind of hang out in the back. Okay, now lastly, let's look at the sternum. There are a few parts of the sternum we need to know. The major parts are called the manubrium, the body, and the xiphoid process. The manubrium is the superior, almost triangle-looking portion. The body is the majority of the actual sternum, right, where costal cartilage is going to be attaching for the most part. And then the xiphoid process is this inferior portion in between the costal cartilage, the costal margin. Okay. At the very top of the manubrium, we have some notches. All right. So on the sides of the notch, we have these clavicular notches, and the clavicular notches are going to allow for the clavicle, which is like your, what is that? What do we call that bone colloquially? I don't remember it, but it's the anterior and lateral bone. Oh, the collarbone, that's what we call it. The collarbone is called the clavicle, and we'll talk about that in the next lecture. The clavicle is going to articulate with the manubrium of the sternum at the clavicular notch, and it'll create the sternoclavicular joint. So that's fun to think about. And then right in the superior surface of the manubrium, sometimes it's called the jugular notch. I prefer to call it the suprasternal notch. Either way, it's fine. We're not going to go over function or anything, but just to point it out, there is that notch, and you can feel that notch at the top of your manubrium as well. Okay, and that's the axial skeleton.